Measles cases in Tennessee have gone from 1 reported last week to 4.
It's an illness that's garnered a lot more attention in the last few years than the decades before. These new cases are said to be in Middle Tennessee, but local health officials have become concerned. Local 3's Madison Sims has this story.
The Tennessee Department of Health says there are now 4 confirmed cases of measles in the state. And while the infection isn't in Hamilton County, Health Department official Stephen Miller says it could be on its way.
This is an emerging process, and we're very concerned for this spreading to other parts of the state. I have concerns for our own county as well.
Measles is one of the most contagious viral infections. It's often spread by respiratory droplets and takes only minutes to contract it.
If we were both in the same, your room or my room, it would just be a matter of just a few minutes before you would give it to me or I give it to you.
Those most at risk of getting the infection are people who are unvaccinated, which is typically children.
We usually see infections more in the children, and that is why we concentrate so heavily on immunizing the children.
The infection is characterized by symptoms such as a high-grade fever, red eyes, and a runny nose. And several days after exposure, people experience a whole-body rash.
You're infectious before you have the rash, though, for several days before and several days after you develop the rash.
There has been 1 confirmed measles death in the United States, and Miller says, at its worst, the infection can result in pneumonia, blindness, and deafness.
95% of the time, these are individuals that are never received the measles vaccination. They're unimmunized, and almost always children. So that's a big concern to us.
Miller says the Hamilton County Health Department has been in contact with the state and school officials to ensure children are vaccinated.
We need to be at 95% vaccination rate for our kindergartners. I know right now we're sitting around 89%, so we do not have what is known as herd immunity right now.
While there is no cure for measles, the treatment consists of managing the symptoms with over-the-counter painkillers and drinking plenty of fluids. For more information on measles and how to prevent the spread, you can head over to our Local 3 News app. Reporting for Local 3 News, I'm Madison Sims.